This short video has been created to introduce our research project, Core Outcome Set for Burn Care Research, COSB for short. The aim of the study is to define the most important issues affecting patients recovering from a burn injury. To make sure we find the best treatments for patients, doctors use evidence from previous studies. The results of several research studies can be compared and added together to find out which are the best treatments for patients. The evidence collected about a treatment from several research studies provides much stronger evidence than findings from a single study. However, evidence can only be compared from a number of studies if they assess the same outcomes. We have to compare like with like, and not apples with pears. An outcome is something we can measure that tells us how a treatment affects a patient's recovery, health, and well-being. For example, how much pain a patient may feel, whether the wound becomes infected, if the patient is left with scarring, or if they feel worried or depressed about their injury. To be able to compare evidence about these outcomes, and to be able to compare like with like, we need to agree on the most important outcomes after a burn injury. This decision needs to involve patients, doctors, nurses, and therapists. To do this, a list of all potentially important outcomes is created. It's important to remember that some of the outcomes here are quite rare. People are then asked to say how important they think each outcome is by completing a questionnaire. This will take about 20 minutes. You will be asked to rate outcomes from not important, rated with a number 1, to critically important, rated with a number 9. The questions relate to the person answering, but it's also important to think about what outcomes would be important to all patients with burn injuries. A second questionnaire is then sent to the people who filled in the first one. This tells the reader other people's ratings of importance for each outcome. The aim of this questionnaire is to try to achieve overall agreement. This also provides an opportunity for people to change their mind. Finally, there's a meeting at which everyone discusses the findings and agrees the final smaller list of outcomes which all burn researchers must report when undertaking studies. In this way, we will have research which we can compare and create strong basis to support doctors making decisions. If you're already part of the study, then thank you. And if you'd like to know more or take part, then please contact us via Twitter at COSB Research or via email at cosbresearch@gmail.com. Thank you for watching.